Diabetic Ketoacidosis (DKA) is a condition where a person, usually with diabetes mellitus type 1, have ketones piled up in blood that causes the body to have high levels of blood acids. Ketone produced in the body when insulin level is low. The cells cannot use glucose as fuel source, low level of glucose intake, and a rapid breakdown of fats. Symptoms of DKA include polyuria, polyphagia, polydipsia, fatigue, vomiting, and fruity-scented breath. Symptoms after testing may include high glucose level in blood and high ketones level in urine. Tests used to diagnose DKA is blood tests to test the anion gap in the plasma or serum. Objectives of the test are to measure the acid anion and base cation balance in the body, to estimate the concentration of unmeasured anion, and also to identify the presence of metabolic disorder affecting electrolyte balance. Relevance between diabetic ketoacidosis and anion gap. Diabetic ketoacidosis means high acids, specifically keto acids in the body. High acids increase unmeasured anions such as acetoacetic acid and beta-hydroxybutyric acid. For each anion produced, it will cause loss of one bicarbonate. This interaction will lead to high anion gap metabolic acidosis. Principle of anion gap. In serum, the anion gap is defined as the difference between primary measured cations, sodium and potassium, and primary measured anions, chloride and bicarbonate, to diagnose metabolic diseases that impact electrolyte balance. Anion gap can be calculated by using these two formulas. Instrument used to measure electrolyte is Electrolyte Analyser. An electrolyte analyzer is a device that measures electrolytes in the body. They are most commonly used to measure sodium, potassium, and chloride levels in serum. Serum electrolytes can be measured by using ion selective electrode. ISE method uses an electrical potential to determine the activity of ions in aqueous solution. The potentiometry principle is used to detect the voltage that arises between the inner and outer surfaces of an ISE membrane in the ion selective electrode technique of electrolyte measurement. Type of sample that will be collected for this test is venous blood sample. The blood sample will be collected by venipuncture into the green top collection tube that contains lithium heparin or ammonium heparin. While the blood is drawn, the patient should not clench and unclench their fists repeatedly because skeletal muscle activity can cause elevation of potassium ion value. Plasma or serum must be separated from cell as soon as possible, as intracellular potassium ion will shift to extracellular, causing falsely elevates of potassium ion. Hemolyzed sample should be rejected since it can cause false increase of 0.6% in potassium ion in every 10 mg per deciliter of hemoglobin concentration. Use fresh sample for analysis. Store the sample in a stopper tube if analysis is delayed. Make sure the meter is on and in standby mode. Rinse and dry ion selective electrode, reference electrode, and stir bar. Change the read out on the ISE meter to ion. Pour the sample into the beaker. Place the stir bar into the same beaker and then place the beaker onto the stir plate. And then increase the stir rate until the stir bar is moving. And then lower the arm with ISE and RE into the sample. Record the reading. Lastly, determine the concentration of ion. Normal value of anion gap is 8 to 12 milliequivalent per liter if the calculation include potassium and 7 to 14 milliequivalent per liter if the calculation exclude potassium. High or normal anion gap metabolic acidosis usually indicates excess acid and or decreased base. High anion gap may be caused by ketoacidosis, lactic acidosis, renal failure, and toxic ingestions. Low anion gap is commonly due to the decreased albumin concentration, as it is the primary unmeasured anion. However, low anion gap is uncommon because it is usually related to the analytical or lab error. Other causes of low anion gap are hypercalcemia and hypermagnesemia, monoclonal and polyclonal gammopathy, pregnancy, and multiple myelomas. Anion gap for mild DKA is greater than 10 milliequivalent per liter, while moderate or severe DKA is greater than 12 milliequivalent per liter. Diabetic patients are associated with the lack of insulin in their body that causes lipolysis to occur. Lipolysis is the release of free fatty acid from adipose tissue. This free fatty acid will undergo beta oxidation in the liver as a replacement for glucose in order to keep providing energy to the body. This process will produce keto acids, acetoacetate, and beta-hydroxybutyrate. Eventually, it will lead to keto acid accumulation that will cause the blood to become more acidic, that is known as ketoacidosis, and become the reason for the high anion gap in diabetic ketoacidosis patients. Advantages of the test are it is a simple calculation and it can be used as pre-diagnosis result. Disadvantages of the test are low unmeasured cation and high unmeasured anion can alter the result. The measurement can be easily disrupted if any problem occurs to the sample, such as contamination or taking medication.